Looks like recording just started. Um, this is a public meeting, so I want to be sure that there's space for public comment. However, it doesn't look like there's any members of the public here. Tom, unless there's anyone in the waiting room.
Nope,
Okay,
no one there.
great. Thank you. So I just copied the agenda into our chat. It's probably easier to read if you take a look at the email that Tom shared with the agenda and some other materials. But going through the agenda in PHAB business, I want to let everyone know that I'm happy that Cynthia Marie is now an official PHAB member. She was approved by the Board of County Commissioners. So finally, official welcome to Cynthia after a lengthy process. But we're really glad to have you on board representing St. Charles. Next, Tom shared the February minutes and then an updated February minutes with some corrections that went out maybe 2 days ago. So I'm referring to the updated minutes. But if you had a chance to read the minutes, could I ask first if there's any other corrections? And if no one has any corrections or comments, then I'll ask for a motion to approve. So any corrections or comments to the February minutes? Okay, then can I get do I ask for a motion to be made, or do I go ahead and can I ask for someone to make a motion to approve the February minutes?
I'll move to approve the February minutes.
Thanks, Elizabeth.
That.
Thank you, Heather. Any opposed? Okay, the February minutes are so approved. And I saw that Ruth just joined, so we're about to move into member announcements, but first, Ruth, do you mind sharing your introduction?
Absolutely. I don't know if you all realize this, but there was 2 invites to this meeting, and one of them was obviously was not the right Zoom, so I was waiting in there. I just sent Thomas an email. Apologies for being late. I am Ruth Fernatico. I am the 2S LGBTQIA+ student program coordinator at Central Oregon Community College. I'm also on the Human Rights and Equity Commission for the City of Bend and the Central Oregon Health Council.
Great, thanks, Ruth. And apologies for the dual Zoom links. It sounds like Deschutes County just switched over to using a Zoom Gov account. And that was the reason for having had to switch. But sorry about that. And thanks for joining.
No worries.
And just going to note, we're not live streaming. It would not give me the option to live stream. So I'm going to have to figure out what the glitch is here. But we are recording.
Okay, so moving on to PHAB member announcements. Would anyone like to raise your hand, and I'll go ahead and call on the hands as they appear in order if you have an announcement to share. Sure. Sarah?
I'm posting 2 things in the link in the Zoom area. We last week, or actually February 6th, a month ago, we had the networking event, and the Google map is just kind of an exercise that we did with a CHW student who every class we have, we're going to have the CHWs kind of go through the resources and post local resources. And then and you'll see that Google link up there. That came out of that kind of meeting. We had about 50 people there just talking about resources and how to share and all that information. And then Unitas and 211 put out their directory. How many of you already know about this? Just curious. Of course, Michaela's like, yay! And so the public resource directory, we started kind of playing with it. And as a CHW, this is like that online directory that is really quite nice, where you could see, you can do a search on resources, but some of those resources need to be updated. So I'm encouraging the CHWs and the THWs to use this, and when they see something, to reach out to the directory to get it updated. And so I was thinking, collectively, if we make sure that this is updated, this is the forward-facing directory for Unitas and 211 coming together. Are there any questions about that? Because I think this is really good to see to have this resource here and make sure it's up to date. I mean, I was really excited when I saw it. Any thoughts? For those people right now clicking into it, I'm hoping people will check it out. Curious what people think.
I think I might need a minute to digest it before I come back with
Yeah, I know.
thoughts, but
if you're like, whoa, yay, that's a good normal reaction in my mind. And so, yeah, dive into it, test it out. We did the Google map knowing that this is kind of like their resources on the ground that might not be in Connect Oregon. So Gwen Jones and I really talked about this and said, it's better for us to tap into a tool like this and keep it updated than to create more tools, if that makes sense. And also the other thing with the CHWs and PSS, sharing out the websites too that people are creating, just to let them know about these tools. So we're trying to create a hub. I know, Elizabeth, that you have a new tool coming out too. I think that just opened up a palliative tool, care tool and resources. So just trying to kind of get that all together and in one place for easy access of sharing. All right, that's my big announcement. Want to make sure that's on everybody's radar screen, especially since we have a lot of people who are networked into a lot of different resources here, and that we really use this tool and get it updated. All right, that's it for me.
Sarah, one question. Where is the map going to live? Where is it?
Oh, so this little Google map is a student project, and I was just going to keep it in the CHW website. I might put it on OregonLearns.net as just a local resource, because what Unitas does is it takes those big ones, right, and Oregon Learn and Connect Oregon, but the boots on the ground kind of Google Map is for us to get informal resources up there too. And we're going to have another CHW class in Madras, so that one will update for the Madras area. So it's kind of an organic tool that's going to live probably on OregonLearns.net for the CHWs and PSSs. I don't really know the answer, but that was me just thinking of off the foot at this moment, Elizabeth. All right, thank you.
Great. Thank you, Sarah. Sarah, would you mind following up with an email to Tom or myself or to all of PHAB, just sharing the resources that you just mentioned, and if you had any specific questions or action items?
Yeah,
That would be great.
Definitely do that. I'll definitely
Great.
get that.
Thank you. And just for purposes of helping Amy with the minutes, could I ask that if you share an announcement, would you mind also typing up like a line or two, or just like the brief summary of what your announcement was to share with Amy? And you can either do that in the chat directly to Amy or via email afterwards, probably. I know it's hard to capture a lot of info.
I have the if you just have any links, I can get the announcements just fine, just by people speaking them. But if you have a link or something, if you just put it in the chat, that will be included in the notes. So you don't need to send me something separate. So I've got it, Sarah, I've got your stuff. And Elizabeth, also I have the link that you shared as well. So we're good. Thank you, Colleen.
Very cool. Sure. Thank you.
Thanks. Okay, thank you. And I see Ruth.
Hey y'all. So I don't know the best way to procedurally to go about this, but in reading the February minutes, I flagged the use of the acronym that we refer to as the queer acronym or the queer community acronym as being short. So the one that we had in the minutes originally was LGBT. The one that I believe is preferred and often used in Central Oregon specifically and is kind of encouraged in general is the 2S LGBTQIA plus. And so I'm essentially addressing this to get uh, everyone's beat on officially changing the way that we use the acronym and adopting the 2S LGBTQIA plus. I'd like to also be available if anyone has questions about those different letters and what they mean. But it would be really cool if we could, as a body, essentially adopt an official path on that.
Thanks, Ruth. And I have the updated February minutes in front of me. I don't see exactly where that was, but I know that we had planned to incorporate that change. And if I remember correctly, it was mostly listed in terms of like your title at COCC. Was that right?
No, I mean in the minutes, essentially there was a discussion about something, and I can't remember the exact um context, but the acronym that was used was LGBTQ. Um, the extended acronym is long, and I wanted to say that up front, but it is worth it in regard to equity and the way that we engage with the community, and it sends, a ton of messages, both very overt and some very subvert about where we stand as a body and as an organization, especially in regard to public health and equity and belonging. I really encourage anyone to have any questions, and I'm happy to type something up as well. I do at COCC and then other places, I actually educate on the acronym, the use of pronouns, and a bunch of other stuff. So if there's any questions that you have about this or any pauses on the adoption of this as our official acronym that we use in regard to the queer community, I'm happy to have anything addressed or talk.
I made that change in the updated minutes I sent out on Friday, and I put it in the chat. What Ruth had shared with me to use in the future.
Yeah. Again, I'll send out an email to everyone if anyone has questions. Please respond. Yeah, I don't know if it's something that we need to formally address or vote on as a board, but I do want to be really transparent about it, about the need to change that. So
Yeah, thanks, Ruth. I appreciate the education, and unless anyone has an objection, I don't see a problem at all with referring to the full acronym. I think we changed it in the previous minutes, and I think going forward, it's just a matter of remembering to include it all. But happy to have more education about the why.
awesome. Yeah, I'll send something out to everyone.
Thank you. Michaela?
All right, I'm adding a flyer into the chat, but the Health Council is partnering with OSU to do a data learning series. And the first one is coming up on March 17th, and that one is focused on data for grant writing. So it goes over why is data important for your applications, where to find public and community data, and how to use your own organizational data to support your proposal or application. And that one is open to all skill levels. And then the second training within the data series is focused on designing your program evaluation plan. And that one is held on April 17th and May 12th. And the Health Council is subsidizing the training, but there is a little bit of a fee to participate.
Very cool. And those two researchers with OHSU are working on a program evaluation project for us right now. That looks like it'll be a really valuable learning experience.
Awesome.
Thanks for sharing. Michaela, while you're up, I wanted to also share another announcement that we were in. PHAB was reached out to by the Behavioral Health Advisory Board to ask if we wanted to co-host with them a RIP 101 workshop or intro session, and that's Regional Health Improvement Plan 101. I'm sure Michaela can share more about what that session would entail. We're still waiting to hear back from behavioral health about the PHAB about exactly what they were intending as far as whether that would target just board members or broader community. But I just wanted to put that on your radar that Tom and I responded like, yeah, that sounds great. Would love to learn more. Michaela, do you want to briefly share with us what that RIP 101 session would entail?
Yeah, so the Health Council just finished a RIP 101 series, and this was for the community and community organizations. And so we covered, what's in the Regional Health Improvement Plan, what are the priority areas, as well as how our role has shifted within this new RIP. So in the past, we used to hold different, long-term work groups and invested, heavily within the communities around those priority areas. And so, our role has had to shift into more of a connector and convener and amplifier of the work that is already happening that aligns with the Regional Health Improvement Plan. The RIP is a 5-year plan. It has always been a community developed and community owned plan. And so we are having to move more into that role. But within the RIP 101 sessions, we also talk about the Be Well Central Oregon and how we're working to strengthen collaborations across the region and recognize the work that is happening and formally recognize the work that is happening. And within the RIP 101s that we have been doing with community partners and community organizations, we do this exercise where we see who within our community, what organizations are wanting to partner and collaborate around different areas within the Regional Health Improvement Plan. And so this would be a way for us to come. We can tailor this RIP 101 to fit PHAB and PHAB and to share a little bit more about the RIP, our role, as well as if there is an area that one of these bodies or both of these bodies would like to advance within the Regional Health Improvement Plan.
Great. Thank you so much, Michaela. I appreciate it.
Yeah.
Okay. Lindsay?
Thank you. I wanted to jump back up to the resource that Sarah put in and just make sure everyone is aware that of what Connect Oregon is and the opportunities that we have in this region to connect partners providing services to the Connect Oregon platform. And so actually the Central Oregon Health Council and Pacific Source partnered many moons ago in getting this resource in the community and have been working, gosh, for the better part of 6 or so years on connecting community-based organizations to this resource. So Pacific Source supports the implementation fees for programs and community-based organizations to partner with Connect Oregon to put all of their resources on here. So the information that Sarah put in here is the public resource tool, which is fantastic. But if your organization is interested in inputting your information here or learning how to connect with other resources in the community by sharing referrals or receiving referrals, I'm happy to connect you with the Connect Oregon team for more information. So please reach out to me if that's something that you'd like to know more about.
I have a quick question, Lindsay.
Yes.
If there's something on the directory that's out of date or broken, who should we contact on that?
I'm not positive. You're welcome to email it to me. I have direct contacts at Connect Oregon. I'm not sure if that's the fastest path or not, but I'm happy to try for you.
Okay.
I wonder if there is somewhere on this. I haven't played around in the resource you shared too much yet, but there might be somewhere in there that you're able to make note of that, but you can certainly email me. I'm happy to explore that.
Okay, great. Because I asked that because there are a bunch of there are people testing it out right now, and they're sending me stuff, and I want to take the middle person out of it and get them to go right to the right person there. That would be, I don't know if there's a form or something, or just food for thought.
Absolutely. I will try to find out, and I see the info at ohlc.org on this website too. you might try them as well, because I know that they're
I'll try
working.
that and see if that's the best way to do it. All right. I'll
Perfect.
email them right now and ask them. All right, thanks.
Perfect. And thank you so much for sharing this. I would just end with, this resource is as good as we make it. And so if you have an organization that isn't accessing or utilizing this, or isn't showing your resources that are available in our community within this platform, please reach out to me. It's a really great opportunity when people receive members or participants that are looking for needed resources. A lot of our frontline workers use the Connect Oregon platform to identify what offerings we have in our community, and then can directly send referrals within this platform to other users as long as you're on the platform. So if you have more questions, please reach out to me, and I'm happy to connect you with the Connect Oregon team.
Great. Thanks, everyone. I appreciate you sharing all that. I want to move along to hearing from Tom about the legislative short session update as part of our public policy updates. Tom?
Yes, thank you. So I just wanted to put it out there that I will probably have a more thorough update next meeting, because the session has not wrapped up yet, and there are many bills that are still nearing the finishing line. I did want to share, though, however, one bill that PHAB advocated for, and also the county commissioners advocated for, was Senate Bill 1571, which adds nicotine products to tobacco law so that they can be more closely regulated and monitored, and to help lessen the chance of being sold to underage persons. And anyways, the exciting thing to note is that it passed out of the Senate, it passed out of the House, and currently it is its current location. Oh, I just had it. They changed it here. Sorry, hang on. It's at the Senate desk awaiting enrollment. So I believe it has to be enrolled, and then at that point, I believe it goes to the governor for signature. So as of right now, that one that we advocated for is looking really well. And then the second big update I want to provide is that PHAB also advocated to maintain public health funding and not make cuts to funding. And we received an email from Sarah Lochner, who is the lobbyist for the Coalition of Local Health Officials, who spoke with us at the December meeting and gave us a legislative update. She said that she saw some budget documents that were posted, and she noted they were fairly vague. However, she said it did not look like there were cuts to public health funding. So this is not 100% confirmed, but as of right now, things were looking pretty well. That did not appear that public health programs were cut for the upcoming fiscal year. So that's a huge deal for us, and you know, just great that the two items that we did advocate for in PHAB were ones that are appearing to be successful. So the session's not completely over, so don't quote me on any of this, but it is looking good as of right now, and I'll have a very thorough update on how everything that we've reviewed already this session, how it finalized. By the April meeting, I should have all that information. Just today, it's some things are still up in the air. So that was the majority of my legislative update for today, and like I said, I'll circle back next month.
Thanks for that update, Tom. I know that one of the reasons that it looked like the budget for public health was not going to be cut after all, hopefully, was due to a bill that we had talked about briefly in our last meeting, as far as Oregon wanting to move forward with, gosh, I forgot the exact word for it, but divorcing Oregon tax policy from federal tax policy in light of the Big Beautiful Bill Act changes that had reduced the tax revenue. And it looked like Oregon is likely moving forward with that. I don't know the exact status of it, but that closes the projected budget deficit largely. It still leaves a gap but it wasn't nearly as significant as had been projected. I can drop a link to an article that shares a little more than what I just did, but details were vague from what I could see until like you get further in the weeds. So look like good news there for now. Commissioner Chang, did you have anything that you would like to add either about Board of County Commissioners or anything having to do with legislative session?
I could just add to what Colleen just said that decoupling Oregon state tax code from the federal tax code on three specific items has allowed the legislature to close $300 million of the budget gap that they were looking at. And, you know, that may be one of the reasons why public health and other programs are not experiencing as severe cuts as they might have. So that's a little bit from the legislature. At the board, over the last month, there hasn't been that much, you know, a big dramatic stuff happening related to public health. Two things I'll mention are, number one, we extended a community health specialist, prevention specialist position, and we were able to, for another half year, we were able to do that primarily based on support from the Central Oregon Health Council. So thank you for that support. For this person who was doing substance use disorder prevention work. And our environmental health division is working on a code change, a minor code change right now that essentially would set up better procedures for us to deal with, for example, someone who had their restaurant inspected and had some kind of, public health code violation isn't the right word. It's kind of a harsh word, but it's just it's out of compliance with law, and then had a suspension of their license or something like that. Basically, we're working on shoring up our procedures for those kinds of contested cases that might come up. But those are a couple of recent board actions on the public health front.
Great. Thank you, Commissioner Chang. Before we move on to hearing about the Public Health Modernization Implementation Plan, are there any questions or comments about the public policy or legislative session? Okay, then I will pass the baton back to Tom for the Public Health Modernization Plan update.
Okay, thank you. Let me just get it going here. Yeah. Just 1 second. Okay, there we go. All right, yes, I was going to possibly present on this topic last meeting, but I didn't because our plan was still being reviewed by OHA, and I thought it would be more appropriate to bring this up after OHA completed their review. And I'm happy to say that just a few weeks ago, we received word from OHA that our plan was reviewed and approved. And so I'm going to share a little bit more about this. I had emailed the plan, the public facing copy of the plan, to the group along with the minutes. The plan that I submitted to OHA contained some documents which had a great deal of personnel information, so we rather not put that out there and just share that with Oregon Health Authority. directly. Lots of fiscal data on personnel that we thought it was better to just kind of keep in-house. And anyway, so you all received that copy, and anyways, the purpose of this plan is that it's required in statute. So when public health modernization was started, they had decided that we would have all these plans that we would need to complete as part of it, and one was to submit a public health modernization implementation plan by December 31st of 2025. And of course, with funding not being as strong over the last biennium as in the past, it can be difficult to reach modernization if the funding streams don't keep coming in where you can increase staff and programming. So anyways, this document serves as a hypothetical view of what would be needed to achieve full implementation based on our ideas of what that is. So the plan has information about staffing, funding, as well as progress made to date in reaching full implementation. We have an assessment that's in there. It contains information on what we think it needs to be fully implemented. And fully implemented, it was determined by Deschutes County Public Health leadership staff, as well as a workforce calculator that I used that was provided by the National Public Health Accreditation Board and the de Beaumont Foundation. And basically, we felt our determination, what's needed here locally, was more helpful because the accreditation board is based on the East Coast, and all local public health authorities have different needs, different community needs, and different situations going on. So we didn't feel like what a national board deemed as fully implemented was as valuable as what we ourselves felt we needed in our community. So just wanted to mention that part. Here are the 4 plans that we've had to submit. We had 3 that were due June 30th of 2025. And then this is the final one we had due. And as of right now, we don't have any major plans that we're going to have to complete. But it was a lot of work from our preparedness program, our climate adaptation program, and our health equity program. And then the final one was the modernization plan, which was the lengthiest and most cumbersome and time consuming. And that was one of my primary directives the last 6 months of 2025. Here's some of the feedback we got from OHA. I'm just kind of was pleased to see all the great compliments. They thought it was easy to read and straightforward, and they said we didn't expect anything less from Deschutes. So that's always nice to hear. They liked our visuals. They thought it was detailed, clear, and we addressed all their required criteria. And also the data we provide, they thought was very thorough. And I sent them some supporting documents as well that were helpful, and we received no corrective actions, and they requested no clarification. So basically our feedback was it's fine as is, it looks great. So really happy that we were able to knock it out of the park. And there were many people in public health that really helped out with this. I was the coordinator of it, but I received input from many, many different people. So it was a real team effort. Very, very happy about it. Some components of the plan include progress in our foundational capabilities and programs over time, just kind of measuring how we've come along since we've started doing this work, snapshot of where we are now, an estimation of what is needed to reach full implementation. As I said, this is hypothetical, so we have to kind of estimate where we think we need to be, and that can change from year to year as economic conditions change, the community changes, but as of this point in time, this is how we feel what we would need to be implemented. We also listed barriers and challenges to reaching implementation in the different capabilities and programs. Those are all listed in the document I sent out. So if you really want to take a deep dive, all this information is in there. And I had to complete the Oregon Health Authority capacity and cost assessment tool to determine FTE and fiscal data. That is a very huge tool where I have to list all our personnel and then decide what program and capabilities they work in, what percentage of their time. And it's very complicated, but the nice part is at the end it spits out numbers to you, what the tool feels you would need to be fully implemented. Here's a sample of some of the visuals that we had in there, is just showing what our current FTE is, what we need for certain capacities or programs to be fully implemented, and then we assessed our expertise and our capacity in each program. And the full assessment is in the appendix of the plan document that I sent out, so feel free to take a look at that. Capabilities, foundational capabilities that you hear me referring to, and I probably have covered these in the past. These are kind of the cutting edge, cross-cutting skills and capacities needed to support basic public health protections and programs. These are some of the more innovative programs that we do. And you know, you hear from our epidemiologists, you've heard from our community partnership development coordinator, and some of the other staff that work directly in these areas. And so that's one thing we assessed. And then the foundational programs, these are the bread and butter of public health. These are the core programs that, if say we had very limited resources, we would focus on these core programs first, as they're the most critical to public health. And these are our bigger primary program areas here at Health Services. And also many public health authorities model their programs and structure based on the foundational programs and capabilities, and we do that here. Our four main program areas are the same as these listed here. As I said, in the end, we did our assessment, and this was done with the management team. And we are lucky enough that from fiscal year 19, I still had results of the assessment that was performed then. So we were able to look from between FY19 and 26 and see where did we improve, where did we stay the same. So where it's green, those are areas of improvement. Where it's yellow, those are areas where we felt we didn't improve, we were about at the same level. And then we had no decreases in any areas. So there would have been red if there was a decrease, but we actually didn't feel like we went down in any of the areas. And these were both expertise and capacity. So basically the knowledge and skills versus, along with, not versus, the amount of staff and capacity basically that we have to implement these programs. So we assessed it for all these standardized definitions under all the different program areas. And all this is detailed in the plan as well. And here's another table. I'm not going to go into detail on this, but it showed where we saw our increases and whether it was a small increase in different capabilities or programs or a large increase. And there's a lot of narrative in this report. The total report is close to 50 pages. And so it's pretty lengthy, but even though we're doing all this assessment work in the report, it actually is a really informative guide to what public health modernization work is. So despite what its purpose was, it really is very informative to someone that just wants to learn more about what modernization work we're doing. Very detailed. And finally, to conclude, we felt that to achieve full public health modernization implementation, we needed more positions for pretty much all the foundational capabilities and programs, as well as some of our direct services program areas. We thought that we would need some extra FD in those program areas. Obviously, if we're not getting an increase in our modernization funding, we're not going to be able to increase staffing. But once again, hypothetically, this is what we felt we needed to achieve full implementation. One thing that was identified is that communications was one area where we thought we needed the largest increase. And then the rest of the areas we felt that the increases needed were not quite as large, that we're doing pretty well in those areas. But that's one that stood out, really educating the community on what's going on as well as what public health is doing. We feel we could really bolster what we have in that area. And once again, the last thing is that this will change from year to year as economic, environmental, and community landscapes change and different gaps appear that we maybe didn't have in the past. So that was kind of a general overview of the plan. I thought maybe if you hadn't had a chance to look at it after you hear my presentation, maybe that might inspire you to kind of go through it. And I can take any questions now at this time, or if you're reviewing the plan over the next few weeks, if you want to shoot me an email and just you have some particular questions over any of the content, I'm more than happy to engage with you in a discussion about that. So any questions? Colleen?
Yeah, I was curious, how does this plan crosswalk with the regional health improvement plan or with the county strategic plan or other like related planning documents?
It does crosswalk, but maybe not intentionally, because public health modernization is so defined with the capabilities and programs. So unless the RIP really incorporated all those capabilities and programs, you know, we can glean things from pieces and parts from different areas, but overall it doesn't necessarily line up. But there are definitely much overlap in our various documents, but we didn't necessarily focus on trying to align it, just because modernization is kind of like its own animal, and just the way that the state has been helping to guide public health work to try to keep it structured. And this all started back in, I believe, around 2015 when we started talking about modernization, and then we began implementing it in 2017. So it's been kind of an ongoing process, and I think there will be also some updates to what modernization work looks like as times have gone on and changed over the last 10 years. Yeah, any other questions? Dr. Fawcett.
Yeah, thanks, Tom. That was terrific. Do you know any other counties that have done a modernization implementation study in the past couple of years around the state?
I know all of them have done it and turned it in by December 31st.
Okay, that's what
Yeah, we were
so my
all
question,
required.
Yeah, gotcha.
Nobody did it sooner. This is just, I mean, it was kind of a mad dash in 2025, and you know, there was a little bit of pushback on it because we didn't get increases in funds, and you know, kind of the argument was, how can we, you know, aspire to reach full implementation if we're not getting increased funding? So anyways,
it seems that, like you said in your summary, that the major room for growth is over capacity more than proficiency, perhaps. I think that's a fair statement.
Yeah.
And I don't know what counties felt differently about that, but it'd be interesting to kind of see how other counties might be able to increase capacity. I don't think there's going to be a lot of examples of that, but we can look into it.
Yeah, I mean, all the plans will eventually be posted online, and you could look at it. But the thing is, the format of every county's plan, we have pretty much our own freedom to set the plan up however we feel works the best. So not all the plans are going to necessarily line up and match. We just had to make sure we met all the requirements that OHA had outlined for us. So, but most of the information should be in every county's plan. You just might have to dig around to find it.
Thank you.
Yeah, it was. I learned a lot from doing that, and I actually feel like I really increased some of my budget and administrative skills putting this together.
I would just add, Tom, it's kind of cool because you were, you know, here at the beginning of this too. So
yeah,
neat.
Yeah, it's definitely been a journey for modernization, and yeah, hopefully we're just going to continue, and maybe at some point in the future we can increase. But for right now, we're happy just maintaining status quo.
Thank you, Tom. Great job putting that plan together and the positive feedback from OHA. Before we move on, do you have any recommendations, like as PHAB board members, if there's any sections in particular that we should pay attention to or that would be enlightening for our role?
I actually think the beginning of the document, before we go in program capability and program, uh, I think just reading the narrative at the start of it is really informational. It's like I can't remember how many pages it is now off the top of my head, but I think you really just starting with the beginning of the document and starting there, I think you'll learn quite a bit about the work we're doing in public health.
Thank you.
I would just add briefly, this has been said before, but I want just to emphasize, the modernization, it's kind of a funny term, I think, but really it's the idea is a recommitment to kind of the foundational tenets of public health for each region, that every region has to maintain foundational programs and capabilities and commit to that. So it's kind of a funny word, modernization. It should have always been that way, but honestly, it wasn't that way prior to 10 years ago.
Yeah, well said. I pulled the document up. I thought I had it up already, but if you read like the first 10 pages, that really will give you a lot of information, and then it goes program by program. If you really want to dig into like assessment and epidemiology, where our barriers and challenges are, and what we've accomplished to date, we go into details on that. If you want to really dig into individual programs. But the first 10 pages are a real nice overview of public health.
That's great. Thank you.
Yeah.
Okay, moving on to the next item in the agenda. Reminder that one of the things that came out of our recent retreat was a desire to have a better idea of resources in the community and mapping those resources and hearing from each other about our organizations and the resources that our organizations provide. And then we came up with like a set of 4 or 5 questions that we asked each member to incorporate into their presentation about their organization. So up for today, Claudia, Education and Training Program Coordinator with Planned Parenthood Columbia-Willamette, has graciously volunteered to be our second guinea pig here. So Claudia, I'm going to pass the mic to you, and thank you so much for being willing to share.
There we go. I think I've got tech figured out, if folks can see my screen, hopefully. But yes, awesome. Okay, yeah. Just as a reminder who I am, Claudia, I am the Education and Training Program Coordinator for Planned Parenthood. So basically what that means is that I do education outreach in Central Oregon. So all of our counties here, including the Warm Springs Reservation. So if it's in Central Oregon, I do education and outreach there. And we also have some team members based in other areas of Oregon as well. And we'll talk a little bit about like what that looks like, what that means, since we are such a large affiliate. So I am part of Planned Parenthood Columbia-Willamette, and Columbia-Willamette is the largest nonprofit provider of sexual and reproductive health and sex education in Oregon and in Southwest Washington. So our mission is to provide, promote, and protect access to sexual and reproductive health care. And really how we're able to do that and how we're able to accomplish our mission is really through these 3 branches of ours. So we have our patient services branch, which is the most known branch of Planned Parenthood. It's where our health centers are able to do their work and provide a wide range of services, namely preventative care. So our providers, nurses, and support staff really take the time to talk to the patient themselves and see them for who they are as individuals and not just a patient coming into our health centers. And our Bend Health Center actually recently hit a goal last year serving 10,000 community members, which is really amazing. Yeah, this is the largest goal that we've hit since we've opened our health center in Bend, which is really amazing. Our other branch is our education and training branch. So that's the branch that I'm a part of. And we deliver programs, resources, tools in classrooms, really all types of trainings and education opportunities to help people make informed choices about their sexuality and relationships, and really thinking like healthy lives and all the aspects that come with that. So in 2025, our education branch served more than 12,000 middle school, high school, and college students with age-appropriate, inclusive, and comprehensive sexual education. And across Oregon and Southwest Washington, we reached 14,000 people through our outreach efforts, which is really, really amazing. And the other portion of that education branch that we have. And last, we have our public affairs branch. So maybe folks have heard of Planned Parenthood Action Oregon. They are our advocacy branch, really, and are leading the movement for sexual and reproductive freedom in Oregon. So they are a statewide advocacy and political voice for our 2 affiliates that are here in Oregon. So us, Planned Parenthood Columbia-Willamette, and then also Planned Parenthood Southwestern Oregon. And they engage in educational campaigns, grassroots organizing, legislative advocacy, really all of the public affairs legislative part of Planned Parenthood. So specifically thinking advocacy, making those efforts through community partners for all of our access. Alrighty, so taking a closer look at our service area, we have 8 physical health center locations throughout our service area, which you can see here on the left. So we have 7 health centers here in Oregon, and then we also have 1 health center in Southwest Washington. So we do service Southwest Washington. The other portions of Washington are for the Washington affiliate. So Bend in Central Oregon has 1 health clinic, where we do provide full scope of sexual and reproductive health care, which we will get into in this next slide here. But an important thing to know is that while PPCW is the largest nonprofit provider of sexual and reproductive health care in Oregon, I mentioned Planned Parenthood Southwest Oregon. They are the other affiliate that is in Oregon that services the lower portion of Oregon. So thinking Eugene, Springfield, Grants Pass, thinking more south, the southern portion of Oregon. Alrighty. So here we can see all of the services that we provide at Planned Parenthood. And really to break down this slide a little bit more, because it is pretty filled, we can see the wide range of our health services that we provide. So the top portion here are services that all of our health centers offer. So thinking annual exams, thinking cancer screenings, STI testing, pregnancy testing, offering PrEP and PHAB, telemedicine as well. And then as we get down here towards the bottom, these are services that are specialized and only offered at select number of our health centers. And this is really due to capacity and who is on site at our health centers. So as of last year, we actually now currently do offer a full range of services here in Central Oregon, as folks can see here. So thinking those specialized services, colposcopies, LEEPs, vasectomies, gender affirming care as well. More specialized services that maybe some of our other health centers may not be able to offer. Alrighty. So we really try to limit any barriers that people may face when trying to access care. So we definitely are very aware of paying for services. So we offer a variety of different payment options when it comes to paying for services. So a most common or familiar one for folks is public and commercial insurance. So that's thinking things like Medicaid, OHP, the Washington version of Medicaid as well, so Apple Care. Private insurances, so employer insurances, we accept those. We are also a part of the reproductive health program, which is a program that is offered here in Oregon, where patients can enroll and have some of their services or all of their services covered by that reproductive health fund. Similarly, we are also part of the abortion access plan, which covers folks whose insurance may be religiously affiliated, and they're not able to cover some of the services that they're coming in for. So we're also part of that plan as well, for paying for services. We, as Planned Parenthood, also have our own patient assistance fund. So this is a fund for people who may not qualify for any of these additional programs, or maybe do not have an insurance, a Medicaid or a private insurance. So we have a fund that is specifically Planned Parenthood Columbia-Willamette. Patients are able to access this fund and then cover the cost of their services. And last, we also offer self-pay options. So this is based on a sliding scale model. So just depending on things like income, family size, it varies on how much a person would pay out of pocket. Alrighty, something really amazing about Planned Parenthood is that we have patient navigators. So our patient navigators are staff who specifically work to help patients with any barriers that they may face coming in to access care. So this is thinking things along the lines of travel costs, lodging, any care coordination that comes into coming into a health center and having or doing a service. So our patient navigators work closely with those patients, help them navigate their healthcare experience, and help them get the access that they need. Whether that's them coming from other areas in Oregon, whether that's them coming from another state, our patient navigators work with those patients regardless of where they're coming from. We also are very aware that our patients come from all areas, and we know that language barriers exist. So PPCW has a language services coordinator, as well as bilingual and OHA interpreter certified staff, who work with our affiliate to provide those resources and assistance when needed. We also are contracted with interpreter agencies to provide services in person or remotely. So we have interpreters come into our health centers, help patients with their visit, navigating any language barriers that they may have, and helping in that way. And then a really cool opportunity that we also offer is an interpreter and bilingual certification training that is not exclusive to PPCW staff. So community members are also able to join, get certified as interpreters, bilingual staff, which is really amazing. We have a call center, which is based in Portland, but does serve all of our health centers. So 7 of those call center staffs are bilingual, and 5 of them are certified interpreters, and all have access to interpretation services if needed. So they are able to talk with our patients, regardless of any language that our patients are speaking, help them schedule an appointment, help them navigate, find whoever they're looking for. Yes, our call center is also where other providers would call when it comes to referring a patient to us. So we do take referrals, specifically thinking those specialized services that we talked about at the beginning. That's mostly where our referrals come to us from. But if some of our other services are needed from folks, usually a referral is not needed. Alrighty, when it comes to education and capacity building, there are kind of two different routes of education that our education department offers. So we offer education presentations. So this is direct education for youth groups, middle and high schoolers, parents, family groups, things along those lines. So it's thinking presentations around boundaries, relationships, healthcare access, contraception, STIs, anything along the lines of sexual and reproductive health care, we are able to do education on. The other route of our education and capacity building is capacity building itself. So this is us offering training workshops for educators, service providers, community workers, folks who are serving youth, folks who are serving community. This includes up-to-date health information, messages to share with clients, and how to apply the material that you're learning, how to apply that to your actual work, your actual job, using those skills in ways that are beneficial for you specifically. Here are just some of our education programs that we offer. So here on the left, we have our Teen Council program, which is our peer-led sex ed program that is for high school students. We also have a College Ambassadors program, which is for college students in our service area who want to be resources, who want to be peer advocates for their campus community. And then on the right here, we have an example of one of our capacity building family workshops. So this is an Askable Adult workshop where parents, folks who are working with youth, service providers, really anyone who is working or has a young person in their life can gain skills, can gain strategies on how to have conversations with the young people in their lives in an inclusive way. Yeah. Alrighty. So while states across the nation continue to ban or restrict access to gender-affirming care and abortion, patients know that they can access that essential healthcare here at Planned Parenthood Columbia-Willamette. So PPCW has stepped up to meet the growing need for providing care. Last year, we broke a record of having nearly 74,000 patient visits at all of our 8 health centers combined. So we remain committed to providing birth control, gender-affirming care, preventative care, STI testing, no matter what. So on the left, we can see that of our nearly 74,000 patients, 55,000 are made up of what we call unique patients. And really what that means is that 68% of those patients are at or below the 200% of the federal poverty level. 70% of these patients are insured by Medicaid, and 31% of patients are between 18 and 19 years old. So we can also see here towards the bottom our patients by age group in the last year. So 18 to 44 years old makes up about 43,000, and then folks older than 45 years are around 2,500. We can also see on the right the types of visits patients have had so far. So more than 130,000 STI tests, more than 5,000 cancer screenings, more than 3,000 gender affirming care visits. We can really break these down here in the specific categories, as folks can see. Alrighty, so what does PPCW funding look like? So Medicaid covers approximately 70% of our patients, like I just mentioned, and 11% actually have no insurance coverage at all. So something to know is that most of the services that we provide are totally unrelated to abortion services, as we saw in that last slide. In fact, 90% of our services are preventative healthcare. That's totally crucial to public health. So thinking things like cancer screenings, STI testing, treatment, wellness visits, things along those lines. So that's where we're getting our revenue from. Expenses, a large majority are going to patient services. So that's supplies needed to fund all of our health centers, things along the lines that have to do with patients themselves. Education and community engagement also takes up a good portion. Because we are an affiliate of Planned Parenthood, we also have national affiliation dues. So that's basically to continue being an affiliate of Planned Parenthood, the larger organization. And then management and general expenses are our second highest form of expenses. Alrighty, so for many people, Planned Parenthood is their only source of care, and making Planned Parenthood health centers, this makes Planned Parenthood health centers an irreplaceable piece of our healthcare system. So I wanted to touch on some strengths, challenges, and overall how Planned Parenthood Columbia-Willamette interacts with public health. So for some strengths, we have new providers joining each of our health centers pretty often. So we're able to expand services to people, expand those specialized services that we mentioned at the beginning. So now folks don't have to travel farther than necessary to access care. We've actually just welcomed 2 new providers here in Bend just this year to expand services in our region. Our priority is always affordable care. And with all of the payment routes we offer, it's easier to navigate and access healthcare for our patients. As I mentioned, we have many different routes for paying for our services, and that's very intentional. Our focus on rural areas of Oregon is also an area of strength that I love mentioning. About 2 years ago, we opened a new health center in Eastern Oregon, which has drastically allowed for the expansion of healthcare access on the eastern side of Oregon. And now folks do not have to travel very far to access our services. So in the past, we've had people travel to Bend as it was the closest location for folks in Idaho, other states. So now with our health center over there, folks don't necessarily have to travel too far to access any of our services. For challenges, states across the nation continue to ban or restrict access to abortion and gender affirming care. And like I've mentioned, patients can access all of those services at our health centers in Oregon and Southwest Washington. So it is no secret that there have been efforts to defund Planned Parenthood, but even with those efforts, we are continuing to care for our patients, including those who are covered by Medicaid. So all PPCW health centers are open, continuing to provide care regardless of if they have Medicaid, if we are getting funded by Medicaid, we're still seeing folks. We also recently expanded our hours to include weekends. So we are now open on Saturdays, really trying to meet folks where they are and limit any barriers. So as lawmakers convene for the short session this year, PPCW is focused on really what matters most, which is securing sustainable funding, strengthening the protections that patients have here in Oregon, and keeping the care, the services that we provide uninterrupted. Alrighty, and last, thinking on the public health perspective, how does PPCW intersect with public health? Really in all the ways I've shared so far, from the services that we provide to the education that's being done, all of which help reduce disease, unintended pregnancies at the population level. We also expand access to care for low income and underserved communities. So thinking health disparities that do exist, and the ways that we're trying to limit those barriers that people may face. Yeah, Planned Parenthood operates at the intersection of clinical care, population care, both of those, and it delivers individual medical services while also contributing to public health objectives like disease prevention, health equity, community education. I've shared a lot about all of those ways so far. Alrighty. That I definitely open the floor to any questions that are coming up. I don't have access to the chat right now, so if there are questions, I welcome them.
Yeah, thank you so much, Claudia. That was really fantastic. I love hearing about the amazing work you're doing. Before we go into questions, I just wanted to being mindful of time. If your question is something that is really specific to your organization, or like your like not something that would for the group itself at large, if you don't mind like being conscientious of that and taking your question offline, and if we can focus our time on questions to topics that will serve like the whole group, would be really helpful. Thank you. Ruth?
Hi, yeah, my question is for those of us on this call and elsewhere who are interested in supporting Planned Parenthood and the mission, but who obviously don't work with y'all directly or are employed by y'all, are there ways that we can volunteer and or offer assistance or leverage any of our resources or organizations to help? I work at COCC, by the way.
Yeah, thank you. Yes, absolutely. We have a lot of different volunteer opportunities, I guess. So folks can come into our health center and help create or help with any patient care packages is what we call them. So really just thinking like medical supplies, moving them from here to there. We also have folks who are able to volunteer to be patient access points. So we have folks who come in once a week, however often they want, and that's helping folks come in and out of our health centers because we do have protesters sometimes at our health center here in Bend and all of our other affiliates. So it's helping folks get from their car inside of our health center safely. Yes, those are the most common ways that folks are able to volunteer.
I'll highlight a question in the chat that came up from Sarah. Sarah says, curious, what is your training for patient navigators? And are they PHN or CHWs so they can bill Medicaid? Sarah also said she's very excited about the College Ambassadors program.
Yes, so our patient navigators are staff from Planned Parenthood. So there is only, I want to say 5, maybe 3 of them who service all of our service areas. So I don't believe that they are specifically community health workers. or receive training along along those guidelines. And they do not do any billing specifically. So they help navigate from some of the funds that we receive. And that's how they navigate where folks are able to.
Sorry, my question was more like how they're trained so that they could bill Medicaid. But I'll ask that question to you. I'll be seeing you this Friday at the event, so I'll follow up offline. It's a technical one.
Okay.
And your college ambassador program is amazing, where you train college students to be ambassadors, and it's a real advocacy opportunity for students. And I think it's still open.
Yes.
So we can give to it. Yeah. 18 to 25. So that's a real shout out.
Thank you so much. Yes, our college ambassador program is open to all college folks who are current college students at COCC, OSU, and also the universities and colleges in Portland, Salem, all of our service areas, Eastern Oregon as well. Any other questions coming up?
Great presentation,
I just have
Claudia.
a comment. Thank you.
Dr. Fawcett, did you have a question or comment?
No, that's okay. I think in the interest of time, I'll let it go. Thank you.
Okay. And there's some compliments popping up in the chat. I think the work that Planned Parenthood does in the community is so appreciated. I was curious, Claudia, if you're seeing an uptick in the number of patients coming in from out of state for services, if you're able to share that.
Yeah. In 2024, we did see a really big increase in the beginning of the year in patients coming in from out of state, specifically Idaho, because we are so close to the border. But because our health center opened 2 years ago, so yeah, 2 years ago, now they're seeing the influx. So we were seeing it here in Bend a lot more than usual. But now they're seeing it in Eastern Oregon as well, which is really, really great, because now folks aren't having to travel 8+ hours to come to Bend, to Portland, to access care. Now they're able to travel a little less. Yeah.
Great. Well, Claudia, thank you so much for your presentation and your work. We really appreciate it. Unless there are any other comments, I will go ahead and adjourn the meeting, but I so appreciate everyone for making time to join us today. Thank you. Hope you enjoy the sunny spring day.
Thank you so much.